Okay, welcome back. This is the third video in Module 1, third video lecture, and it is part 2 of Worden's Chapter 1. We were beginning to talk about the manifestations of normal grieving as opposed to complicated grieving or traumatic, and these are aspects of the grieving process that the average individual experiences. Most people go through these things, or at least some of these things, as they experience grief. So just like Worden divided this into primary categories, we can look at feelings first, and different types of feelings that people experience. Of course, one of the most obvious feelings is sadness, but this would include crying. It evokes sympathy and protective reactions from others. It's an expression of our emotion. It is a release, an emotional release, crying, and many people try to suppress feelings or are afraid to lose control or feel as though in our society this might not be acceptable. And that's unfortunate, because sadness and crying and all of the things connected with that, we have those experiences for a reason, and there's nothing wrong with that. Americans, of course, value happiness. Most cultures understand that experiencing the full range of emotions is actually a good thing. Many Americans think something's wrong if we're not happy. But in reality, the greatest growth that I've experienced in my life is a result of sadness, struggle, difficult situations. Those are the times that I grew the most, both emotionally and cognitively. Anger can be confusing. I believe that's a secondary emotion, and that there's a deeper emotion that results in that anger. And when people are experiencing grief and loss and experience anger as a result, it's important for them to try to connect with whatever the deeper emotion beneath that anger might be. And if they're able to identify that deeper emotion, then they can work through that emotion. And it'll give them more insight into the loss, the relationship, and themselves. It may result from a sense of frustration that perhaps there is nothing they could do to prevent the death or loss, or from some kind of regressive experience that occurs after a loss of a loved one. Perhaps they experienced a number of losses. Perhaps it reminded them of a loss that was perhaps complicated in some way years ago. And this new experience, this new grief, tapped in to some unfinished business. One may also be angry at the deceased individual, which might seem strange to some, but it's actually very normal. Even though this might not seem logical, anger can be a result of feeling abandoned, or the result of feeling as though life is unfair. Anger can also be turned inwardly to oneself, which can be very maladaptive. Guilt and self-reproach, which can also include regrets, past, future, and we're going to go through an entire chapter that talks about regrets and regret therapy, and I'll talk about my own regret theory in the future. And this is also very common, and it could also be connected with some irrational thought processes, or even magical thinking, which we will also talk about. Anxiety can cross the full range to panic attacks. It could lead to phobias. Survivors may believe that they cannot live without the other individual. The loss or salience also heightens awareness of our own mortality. And we'll talk about loss and salience as well. Loneliness includes emotional loneliness and social loneliness. Fatigue. Experiencing extreme emotions is exhausting. Fatigue may be experienced as tiredness, apathy, listlessness. A very common experience is that of helplessness. It's a valid emotion experienced with loss, and helplessness in many different areas, connected with the inability to prevent the loss, to perhaps have helped the individual, perhaps experience less pain or suffering, or a helplessness in many different results or impacts of this loss. So perhaps helplessness connected with socioeconomic impacts, the inability to change a situation. Shock occurs especially with sudden or unexpected circumstances. Yearning or pining is common and can be used as a barometer of the grief process. Emancipation can be a positive feeling after death. It could also be linked to guilt. Let me give you an example of that. If an individual is caring for another person for an extended period of time, and they see that other person suffering, perhaps they're in hospice, perhaps they're dealing with a terminal illness, and then that person dies, there may be a feeling of relief or emancipation. First, for the other person, that they are no longer suffering, but also for oneself. And that is a legitimate feeling, but we often believe, we shouldn't feel that way. So then it may be linked to some form of guilt. I'm not a good person. I should just be mourning this loss. I shouldn't have these feelings. So relief is connected with emancipation. It's a very common feeling, especially if there is suffering. This can also be related to guilt. Numbness, the lack of feelings, also very common during the grieving process, usually right after learning of the death. It's perhaps our own psychological or physical way of dealing with a shock due to such a variety of emotions being experienced. The second aspect that Worden talked about was physical sensations or somatic. And Lindemann also made a list of commonly experienced physical sensations. So these fit both with Worden and Lindemann. A hollowness in the stomach, a tightness in the chest, tightness in the throat, oversensitivity to noise, a sense of depersonalization, like nothing's real, like you're in a dream or a nightmare, or everything's in a fog. There's a sense of unreality, shortness of breath, a weakness in the muscles, a lack of energy, a dry mouth. It could be sickness, an upset stomach, a lowered immune system. So this is just a short list of possible physical reactions. Cognitions. Thoughts may persist and trigger depression or anxiety. If it's a diagnosable depression or anxiety, it will then move into some type of probably a complicated grieving. But what might be considered normal depression or anxiety, so I know normal is a strange word to use, but we're really talking about the severity of depression or anxiety. Disbelief after hearing of the death. Confusion, disordered thoughts, difficulty concentrating, or forgetfulness are common. A preoccupation or obsessed thoughts about the deceased. The unexpected loss of a spouse with whom they experienced a highly conflicted relationship, and that could lead to complicated grieving as well. A sense of presence. It's a counterpart of yearning. The grieving person may believe that the deceased is still in the current area of time and space. And even though Americans often don't think this is normal, once again normal, or acceptable in our culture, other cultures do accept this feeling of the deceased's presence. Hallucinations, both visual and auditory, can be transient, illusory experience. And once again, we're talking about severity, but this is also fairly common in other cultures as well. Behaviors, of course, sleep disturbances, too much or too little, is very common. Can also be a sign of depression. Appetite disturbances, eating too much or too little. Absent-minded behavior, social withdrawal. Dreams about the deceased are very common. Restless overactivity or hyperactivity, or sighing, crying, visiting places or carrying objects. Treasuring objects that belong to deceased is also very common. So grief and all of these things, those lists of 4 primary activities, are very acceptable and normal unless it begins to become a detriment and leads to complicated grieving. Grief and depression, similarities and differences. Freud wrote in the early paper called Mourning and Melancholia. Many depressions may be precipitated by a loss. Depression can also serve as a defense against mourning. Could result from anger being directed towards the self. Deflects feelings away from the deceased. Main distinctions include loss of self-esteem. The world may look poor or empty. Cognitive therapists see the depressed as having negative evaluations of self, the world, and the future. The DSM also allows for this distinction with symptoms associated with depression rather than grief. You can see Worden for a longer definition of this. That's the end of our discussion on Worden, Intro and Chapter 1. And I will be talking a little bit about the chapter I added to this module, and we'll go over that in our next video.